Recording always takes a second. Welcome, everyone. We are excited to have you here to discuss Love Your Heart. It's that importance of taking care of that heart, and being February, it's a great time to do that and to kind of refresh our thoughts on that. We're excited to have Erica with us today, who is a board-certified nurse practitioner, and she has experience that spans being in an ER, primary care, pulmonary care, medical managing of weight loss. And currently she is part of our community health team, which allows her to be an educator to go out and speak and share her true passion, which is educating individuals on wellness and prevention. And we are so blessed to have her. I get a chance to work with her often, but she has a wealth of knowledge and a dynamic personality in order to share this information. So I am going to introduce you all to Erica, and Erica, let you take this over.
Thanks so much, Jean Marie. Welcome, everyone. It's my pleasure to join you today to talk a little bit about heart health. And wellness, prevention, and education is what we do on the community health team at BayCare, and it's our passion, and today is no exception. So today we'll be talking about taking care of the most important muscle, which is your heart. And it's fitting that we talk about it today because not only is it the day before Valentine's Day, but also we're right in the middle of February, which has been designated nationally as American Heart Month. So this is really good that we're taking the time to zero in on this today. The reason we pay so much attention to heart disease is because it is the #1 killer of all men and women across races and all races and ethnicities. A lot of people think that maybe cancer is the leading killer. It's not. In fact, 10 times more women die each year from cardiovascular disease than they do from cancer. So it should be on our radar. A brief definition, cardiovascular disease is also oftentimes called heart disease. It's just any condition or disease state of the heart and its blood vessels, which can result in a heart attack, a stroke, atherosclerosis, and a number of complications. The risk factors for heart disease are many. On the left, you'll see what we call the modifiable risk factors. These are things we can do something about, and we'll discuss prevention strategies for these later on and management strategies as well. On the right, we have the non-modifiables. We can't really do many things about these risk factors, but it's important that we acknowledge them so we understand how many risk factors we have stacked up against us. And like they say, maybe you can't change the hand you were dealt, but you can change how you play the cards. Today, we'll discuss these 6 common cardiac conditions. A light touch. We're going to make this just general information since a lot of people are curious about these. We'll drill a little deeper into hypertension and atherosclerosis because those are the nuts and bolts of heart disease. So let's begin with the aneurysm. A lot of people ask about what this is because it is scary to hear about. An aneurysm is just any weakening or outpouching of the artery wall. And you can see that can take several different forms in that illustration on the left there. This can be something you were born with, making it congenital. Sometimes we don't know why you have it. Other times it's a result of arterial disease. Maybe you have artery wall damage from smoking or hypertension or diabetes. They can occur anywhere in the body, really, but the 2 most common areas are aortic, which is in your abdomen, and cerebral, which would be in your brain. A lot of times these are picked up as a result of maybe being worked up for another condition. Imaging studies get done or assessments, and then they'll notice one of these things. Usually they're silent. They don't produce any symptoms until they become very problematic when they leak or rupture. If you have a cerebral aneurysm that ruptures or leaks, it could be called the worst headache of your life. It might be called something like a thunderclap headache and lead to loss of consciousness. Similarly, in the aorta, if it leaks or ruptures, you might have abdominal pain, chest pain, high heart rate, low blood pressure, and loss of consciousness. That's a medical emergency. When you head into the ER, they can take a look through a CAT scan or even an angiogram, which is a study that can look at blood flow through the various vessels. If you have an aneurysm, they may just decide to monitor it and do nothing at all. They might use medications, maybe to lower your blood pressure, lower your risk of a rupture or a leak. Obviously, if you've already ruptured it, it could require surgery, or if it's ominous looking enough, they may elect to do surgery there as well. Murmurs we get asked about a lot because they're pretty common. It's just occurring when there's turbulent or abnormal blood flow across the valves in your heart. This gets picked up when your provider, your nurse, your doctor is listening to your chest, and they might hear like a whooshing or a swishing sound. And they might, ask you at that point, have you ever been told you have a murmur? Have you ever been diagnosed with one? How long have you had it? And they'll start to investigate it. They come in two different varieties. Innocent and pathologic. Innocent is just like it sounds. It's not harmful. A lot of children have innocent murmurs as they grow through adolescence and they eventually grow out of them. Pregnant women can have transient murmurs as well. Pathologic can be harmful. This can be related to a problem with the valves, maybe a heart defect, or even an inflammation of the heart like endocarditis. Most of the time, these don't cause any symptoms. So we don't know we have them until someone listens to our chest. If they do cause symptoms, it's more of your garden variety cardiac type, like maybe chest pain, palpitations, shortness of breath. So you'll need to get that worked up further. That can be done with a chest x-ray, an EKG to look at the electrical conductivity of your heart. The most useful one probably is the echocardiogram, which is just an ultrasound. They take the transducer, run it right over your chest wall and your heart, and they look at the blood flow through the valves. Sometimes you just need to have it monitored. They'll just make sure it's not progressing and it's not harmful. Maybe you'll have some medication to lower your heart rate or your blood pressure. If it's complicated enough, they may recommend surgery for you. Pretty much everybody has a level of familiarity with heart attacks. In fact, about 800,000 people per year in this country suffer a heart attack. This results from impaired blood flow to the heart. And this could be from a couple of reasons. Maybe you have a clot that's formed or plaque that has really narrowed the opening of your artery. It could also be from something called a vasospasm, even though this is more rare, where the artery walls actually contract down and restrict the flow. No blood flow equals no oxygen. And when that happens, you get cell death in the myocardial muscle, in the heart tissue itself. This can be asymptomatic, although typically you're not just going to pick it up on an EKG. Generally, there are symptoms. That can be the classic textbook kind, like chest pain, shortness of breath, nausea, pain down the left arm, up the left jaw. Sometimes it's more atypical. You might think it's your reflux acting up, or an ulcer that you've had, or pain in your back. So it's important to understand what your baseline is with these things. And if anything goes beyond that or is concerning, that you have it evaluated. If you go into the ER with these kind of symptoms, they're going to run an EKG on you. They can pick up lots of different things off there, including a heart attack. They will also do a chest x-ray as well as draw a lab. There are certain values that go up on your lab work that signal that there's injury to the cardiac muscle, so they can use that to take action as well. Some interventions for heart attack include going to the cardiac catheterization lab, where they're going to take a guided catheter wire up into your heart to the level of the blockage. Sometimes they will use a balloon angioplasty to pop open the plaque that's formed. Sometimes they can put a stent in. Other times they might bathe the clot in something called a thrombolytic, which is a clot buster, to try to get it to disintegrate so we can restore blood flow. It's crucial to get that oxygen back to the heart. So don't sit on these symptoms. Time is of the essence in seeking treatment. A stroke is very similar to a heart attack. It just has an end target organ that's different. So, and it nearly has the same rate as heart attacks, which is curious. It works out so that these are the same mechanisms, but just different organs. It results again from impaired blood flow to the brain. This means no blood flow, no oxygen, and that's right, neuron death, or cells in your brain are going to die. They are exquisitely sensitive to low oxygen levels. So again, it's important to get on this quickly. They can be ischemic or hemorrhagic. Ischemic just means no blood flow, no oxygen. There's a clot or a constrictor or a blockage. Hemorrhagic means that you're actually bleeding into the brain tissue itself. A TIA is a related neurologic phenomenon. It stands for transient ischemic attack, also commonly known as a mini stroke. This occurs when you have a blockage of some sort and you're getting stroke-like symptoms, but it resolves on its own. It doesn't last as long. However, this is still a red flag. If you're having a TIA, that means conditions are ripe for a stroke and you're going to want to get evaluated and treated for that as well. American Heart Association recognizes how important it is for us to jump on these symptoms, so it gave us a really easy to understand acronym for identifying the ominous ones. It's FAST. F is for face. If you're looking at someone and they're drooping on one side, it's asymmetric, that's a warning sign. A is for arms. If they're lifting their arms, one is lagging, it's a lot weaker than the other one, that's a warning sign. S is for speech. If it's slurred or nonsensical or confused, that's a warning sign. T is time. It's just time to call 911 and get moving. Once you hit the ER, they can do a CAT scan of your brain to identify if you're having a stroke, and if so, what kind is it? An MRI could be done, different views of the vessels through an angiogram. It's important to get in a certain amount of time. There's a close window that you have to treat these within. They can use medication, a clot buster, to clear that obstruction. If you're having a hemorrhagic stroke, you're going to need to go to the OR and have that clipped and have the blood evacuated. Hypertension or high blood pressure impacts all of these things. It increases our risk for both heart attack and stroke. Roughly 70% of Americans age 65 and older have hypertension. Our incidence goes up with age. Sadly, of those, only about half of them have it under control, and this is for a variety of reasons. And when we look at adults across the entire adult age span, we see that roughly half of us have high blood pressure and only 22% of us are controlled. So we have a lot of risk factors that need to be dealt with here. Hypertension just means that you have a high force through your blood vessel, higher than normal. This can be from a variety of causes. It could just be genetics. It could be the DNA that you were handed. It could be from smoking. It could be from obesity or alcohol overconsumption. There are a lot of causes of hypertension. It does affect every single organ system in the body, not just the heart, not just the brain, everything from your liver to your kidneys and in between. The problem is we don't know it because in general, there are no symptoms of hypertension. And that's why it's called a silent killer. The only way we do know if we're running high is by taking our blood pressure and doing serial measurements and logging it. That's how we're going to identify trends. If you take a blood pressure when you're seated and you've been rested for about 10 to 15 minutes, you're going to notice a trend in how you run. That's important information to collect. Thankfully, we have a slew of blood pressure medications that can be used to treat it, as well as lifestyle modifications that we'll talk about coming up. These are the American Heart Guidelines that have been issued. 120 over 80 or below is still where we like to see people. That's considered normal, and it goes up incrementally from there. It's important also to know that your blood pressure will go up and down throughout the day. That's completely normal, but you want to take those resting measurements and identify trends. That's important to take back to your provider. Atherosclerosis is a troublesome buddy of hypertension a lot. It just refers to plaque deposition on the artery walls. And this is a lifelong progression. There have actually been studies done where they look at 20 and 30-year-olds on autopsy, and it's been showing they're already developing atherosclerosis and plaque. But the problem is when we're in our 20s and 30s, that's the last thing we're thinking about. So when we sort of zone in on it in our 60s and 70s, we've been accumulating plaque our entire life. You're not going to know you have this for the most part, typically no symptoms. If you have enough restriction, enough plaque narrowing your arteries, you could have maybe chest pain, a heart attack, or a stroke could even occur. There are a variety of imaging studies that can be done to evaluate exactly how much plaque buildup you have. You could also undergo something like a nuclear stress test or a treadmill stress test, where they tax the heart and see how well it pumps blood and delivers oxygen. There are a lot of medications that can be used for atherosclerosis. Unfortunately, we don't have one yet that can reverse plaque formation, but we do have meds that will slow it and stabilize it to some degree. There are procedures you can undergo, like a balloon angioplasty or a stent. If it's severe enough, some people have open heart surgery where they graft a new vessel and they bypass that area that's too clogged. And there are a lot of lifestyle modifications we can use as well. This plaque is a problem, so let's look at how it's formed. This relates back to blood values that you get drawn at your physicals each year. This is a lipid panel. It's a few of the features, not all of them from your lipid panel. And to understand plaque, we need to understand this. And a lot of people commonly refer to this as their cholesterol level. A word about cholesterol. There's no good cholesterol. There's no bad cholesterol. Cholesterol is actually imperative for life. Without it, we don't live. It's in every cell membrane in our bodies. It's used to create important hormones. And our livers make about 80% of the cholesterol we carry around. The problem is the carrier particles for this cholesterol. The first one we're going to look at is HDL, high density lipoprotein. This particle carries excess cholesterol, picks it up out of the blood, delivers it back to the liver where it's packaged and eliminated. This is a good thing. For this reason, it's thought to be protective against heart attack and stroke. We like to see those numbers as high as possible. The LDL is low density lipoprotein. This is considered a bad actor. It contains a higher concentration of both cholesterol and triglycerides, and it has a sticky particle on the outside called ApoB. This allows it to adhere to the artery wall, set up shop, deposit cholesterol and triglycerides, and this is atherogenic. This is how we get plaque formed in the arteries, and it leads to the restriction of blood flow. We like to see those numbers as low as possible. The triglycerides are fatty compounds that we form when maybe we eat too many calories and we're not burning it off doing anything. So the body stores it up later and for energy. But if we don't use it and we get too many of these particles floating around, they're going to deposit on your artery wall as well and cause plaque. So again, those we like to see on the low side. And this is what it looks like. Over here on the left, we have an artery that's got a large amount of plaque buildup on it. That's what's represented by the yellow and the white there. Those are LDL particles that have set up shop on the artery wall. You can see that the blood flow is really constricted there. And the body forms a sort of white cap over it. It tries to help out to contain it, but the cap can rupture, and then you'll have triglycerides and cholesterol floating downstream. But that's not the worst of it. Actually, the body responds to the site of rupture by forming a clot. And as you can see there, where we had just a little blood flow before, we now have none. So if that artery on the left is corresponding to the artery we're looking at on the wall of the heart here, you'll see there's no blood flow, and all that purple area is representing cell injury and cell death in the heart. Similarly, if this artery here is in the brain, this is going to be a stroke. So we have every reason to want to prevent this plaque buildup, prevent hypertension, mitigate our risk. And luckily, we have a lot of lifestyle modifications we can use to our advantage. Physical activity is typically one of the first things people think of, and the American Heart Association has given us some guidelines to abide by. 150 minutes of moderate activity aerobically per week, couple sessions of weightlifting, resistance training. Also, the benefits to these are endless. But the overarching theme from American Heart is move more, sit less. We know through good science that physical activity can lower our blood pressure, strengthen our heart muscle, help us maintain a healthy weight, reduce our risk of atherosclerosis. And you know what makes every single one of those worse? Sitting. So if you're someone who's already entrenched in a really good exercise program and you're hitting the gym 5 days a week, I applaud you. You're doing so much good for your heart. If you're not, all is not lost. Anything you do, no matter how small you think it is, will help. Getting up, taking a 5-minute walk after your meals, or a 10-minute walk in the evening, engaging in walking the dog, vacuuming, any sort of movement that you're doing is better than nothing. Standing, setting up a standing desk instead of sitting in your chair all day. No kind of movement is too small. And that's one of the most exciting things we found out about heart health is that physical activity pretty much helps everything. So go ahead, start somewhere. You're not wasting your time. I think a lot of people don't realize how much sleep affects our heart health. And the American Heart Association has recommended that we get 7 to 9 hours of good quality restorative sleep per night. This allows hormones time to recharge, to bottom out, allows our blood pressure to drop, allows our heart rates to drop. There is a lot of good science that links sleep deprivation and hypertension atherosclerosis, abnormal heart rhythms, heart attack, stroke, obesity, the list goes on and on. Another threat to our heart health is untreated or undertreated sleep apnea. When we don't have people using their BiPAP or CPAP appropriately, or not getting worked up if they think they might have sleep apnea, this puts a strain on your heart. It could result in congestive heart failure, atrial fibrillation, and hypertension. However, we all know sleep is good, but a lot of us have trouble sleeping. And there's a tool that you can use called a sleep hygiene habit. And basically, this is just a bedtime routine for adults. It turns out that everything we do throughout the day is either going to set us up for success or failure as we sleep at night. So as you're going through your day, an easy thing to do, get sunlight, get outside. Getting out into the natural sunlight resets our circadian rhythm to the way it's meant to be by nature, so that we're awake at appropriate times and we're sleepy at appropriate times. Dimming the lights before you go to bed, turning down those bright electronics, taking away anything that's mentally stimulating, upsetting, anxiety provoking at least a couple hours before bed. Dropping the temperature in your bedroom. Our bodies need to come down a good 1 to 3 degrees at their core before we're able to fall into an appropriate sleep wave pattern, making sure the temperature is appropriate as well. Limiting alcohol and caffeine past midday. A lot of people have trouble sleeping after they've consumed either one of those. So there's a whole host of things you can do that will set yourself up for better sleep. You can find a lot of resources online, including through American Heart Association. So I encourage you to check those out. They really are helpful. I think we all know that stress affects our hearts. We can feel it in our heart rate. Short-term stress is not a bad thing. It's what gets us out of bed in the morning. We get productive. We knock down those tasks that we have to do. Chronic stress is a problem. It eats away at you. When we have increased levels of cortisol, epinephrine, norepinephrine, this is damaging to the body. It can lead to hypertension, increased heart rate, and then we start excreting a lot of inflammatory markers. And when we follow those, we find that we are more prone to coronary artery disease like atherosclerosis. And we also find that high stress hormone levels keep us from losing weight. So it's actually working against us. Additionally, a lot of us don't have the greatest behaviors. We have maladaptive behaviors in response to stress. Maybe we eat too much or drink too much, or we smoke, or maybe we give up our exercise routine because we just don't feel like we have room for it. It's the exact opposite of what we need to be doing. Good adaptive behaviors are ones you need to have in your back pocket, because when you're under stress, you're not always going to be clear thinking. You need to have a go-to plan. Maybe for you, that's breath work. There are breathing exercises that can actually bring your heart rate, anxiety, and stress levels down in the moment. Maybe it's just any sort of physical activity, any sort of movement. Maybe it's a mindfulness app. There are so many out there now that you can follow for guided imagery. There are a number of things you can do to bring your stress level down. In general, social media is not one of them. New science is showing that it actually increases our stress and anxiety levels, but socialization is good. Just try to do it with a real live human. It's amazing what socializing with someone else, sort of getting out of your own head, engaging in laughter can do for your stress levels. Diet. Everyone understands that diet plays some role in heart disease. There is not one diet that's recommended above all others. And be wary of any guru on, social media or otherwise that is telling you they have the one diet that fixes everything. We are all uniquely diverse in our genetics and they affect us differently. However, in cardiology, the Mediterranean diet has become kind of a good framework to draw from. This diet emphasizes fruits and vegetables and whole grains and fiber, some low-fat dairy, fish, poultry, and olive oil. But probably the most important thing is what it doesn't include is a lot of processed and packaged foods, refined carbohydrates, fatty meats, added sugars. And we can probably all recognize that these are part of our standard American diet. And these are all very inflammatory. Inflammatory foods are more likely to contribute to atherosclerosis, hypertension, and diabetes. The Mediterranean diet is well liked because it is anti-inflammatory in nature. So I encourage you to check out any of these ideas. pull some of these foods into your menu. This is not a hard one to do. This is a tasty diet. You really don't have to sacrifice a lot, but also to go back through your fridge and your pantry and look for the ones in that last line there. Try to eliminate as much of those processed, refined, sugary foods as you can, and you'll be doing your heart a favor right off the bat. Last but not least, a very important tool in managing and preventing heart disease is our medication. And one thing that we find in the healthcare field is that people are reluctant to have to go on a high blood pressure medication or a cholesterol medication. And a lot of times there's a lot of bargaining that goes on. Give me a little bit of time. I can do this. I can bring it down. And unfortunately, I think it's because a lot of people think that their hypertension or their atherosclerosis represents a personal failure on their part. And that's just simply not true. This is just a medical condition like any other medical condition. And we have a lot of ways that we can treat it, including medication. So discuss with your doctor the right combination for you. Understand what you're taking it and what purpose it serves. If you're having side effects, you find your medication intolerable, have that conversation. There are so many different combinations we can come up with because the medications only work if you take them. It sounds trite, but a lot of people have trouble with that. So make sure you have the conversation about finding the right medication for you. And so your to-do list for today is to, if you don't have one, go ahead and find a home blood pressure cuff. They're really affordable. If you can't get a hold of a home cuff, you can visit any of the drugstores, or most local Publix locations have a Higgy machine in there, which runs the BayCare wellness program on it. You can take your blood pressure, you can get education through it, you can sign up for an account. It's really useful. The only way we know if we're trending in the wrong direction with our blood pressure is by taking those measurements, writing them down, and taking them with us for our rechecks. Also, make sure you're up to date on your lab work. We cannot change what we do not measure. So if we're not looking at those lipid panels and all the other blood work that gets ordered, how do we know if we're making any progress? How do we know our level of risk? We just don't. So make sure you get the blood work done as well. There are a number of other things that can be ordered at this point. Talk to your doctor about looking at inflammatory markers that will let you know how inflamed you are. Does this set you up for increased risk of heart disease? We have scans that can be done. A coronary artery calcium score is very popular right now. That's a CAT scan of your heart where it looks for calcium buildup in the coronary arteries, helps to predict your risk of a heart attack. There are also several ultrasounds that can be done, whether it's over your carotid arteries up in your neck to look for blockages, as well as an ultrasound over your aorta to look for potential aneurysms. There are a lot of things we can do to get out in front of heart disease these days. So have a conversation with your doctor and your provider to see what you can do, what's available to you, and they can help you understand your results. So in closing, your heart works hard, it needs your help. And my hope is today you'll leave with a little more knowledge than you came with, and that maybe one or all of those prevention strategies and tools will appeal to you and help you to take a more active part in your heart health. And with that, I'll open it up for any questions you have.
Thank you, Erica. That was great. One of the questions someone asked, because I had to hop off, was, will they be able to view this presentation later on? And yes, we do record our presentations, and then we put them on our BayCare Presents site, and I have put the link in the chat, and you will be getting it when I send out the follow-up email. I'm also dropping in next month's presentation, which is the psychology of wellness that Dr. Moser will be talking about. We've had a question about if you could give a little information about what a mitral valve regurgitation is.
Mitral valve regurgitation occurs when there's a trouble with the mitral valve in the heart. So and it's a type of murmur that you'll hear. So if you have valves that are not closing properly, maybe they're not closing all the way, or there's some kind of calcification that's getting in the way there, instead of going in the correct direction, some of the blood squirts back in the wrong direction. And that creates that turbulence in there that you can hear. A lot of times it depends on how bad it is. They'll do an echocardiogram to see, maybe you need something for it, maybe you don't, but it just means the blood flow is literally regurgitating in the wrong direction, and we can hear that when we listen to your heart.
Excellent. And I think a big piece is you have to start that conversation with your doctor. If something's not quite feeling right, or if you have some family history, or you're feeling more fatigued than you felt before, it's always good to have that primary care physician begin that relationship so that they know some stuff that's about you. And if all of a sudden things start being different, that's when they can become aware of, now we need to send you someplace else. I think that's something we talk about every month. We had a question about, and I don't know if this is within your scope, nerve pain in the left arm other than a heart attack. As an exercise physiologist, I know sometimes there could be some pressure because of poor posture and stuff like that, but is there anything else that could be having it that's not a heart attack and the pain comes and goes?
So sometimes, nerve pain, it can come from your neck, it can come from your shoulder, and that can be confused with cardiac pain. A sort of general but not comprehensive way for us to tease that out. Sometimes we'll ask people, when did it start? What were you doing? Does it hurt you when you sleep? Did it get better when you sat down? Were you doing something that was cardiovascular when it started? Did it go anywhere else? Nerve and musculoskeletal pain tend to behave a little differently than cardiac pain, which is, now that we've seen the diagrams, in response to decreased blood flow and oxygen. So you can't always tell, to be honest, but there are a lot of ways that you can sort of delineate, oh, well, it was when I was reaching over my head to get something and then I put my arm down and I was okay, versus, wow, I was walking up a hill, I started to have left arm pain and a dull ache, and then I sat down and it seemed to get better. That is going to tell us maybe there's more of a cardiac origin to it, but you can't always be certain about that. So it's best to have a visit with your doctor and probably an EKG and a few other things.
Yeah. And it's a good idea maybe to write down some of those incidences so that you can, because when you sit there with the doctor, sometimes you're going, oh, I can't really remember. So if you make yourself a little note and make sure that they kind of can see what's going on, it'll help them to help you even more. What causes WPW and what's your best treatment?
Wolff Parkinson White syndrome it's kind of a rare abnormality of the heart rate. So a lot of people will have a heart rate that takes off. That is probably best left to your cardiologist because there are a number of different things they can do, and I haven't followed the most up-to-date intervention for WPW.
We will be having a cardiologist. I'm reaching out to try and get one of them to come later this year. So hopefully that's a question we can address for you at that point in time. And again, Erica will answer what's in her scope. With congestive heart failure, with the fluid, could you give a couple of little details about that?
Sure. Congestive heart failure is another cardiac phenomenon that we see fairly often. It put simply, it's just when the heart can't pump the blood around effectively, either because it's damaged, maybe from a heart attack, or it's gotten big and sort of floppy and ineffective because of hypertension. But when it's pumping the blood around, there's a certain force that needs to be maintained. When we don't have the force behind it, or when we have blood pressure issues, the blood tends to sit longer than it should. The fluid portion of the blood can seep out. So that's going to go wherever gravity takes it. A lot of times we'll see that with edema in the feet and ankles. You'll have a lot of swelling, or it goes into the lungs. It will seep out into the lungs because that heart muscle is just not doing an effective job of pumping the blood volume around. Sometimes people will come into the ER in acute CHF where they're shortness of breath. They feel like they're drowning. So much fluid has been accumulated. That's when it's really gotten out of control. But there are a lot of medications that can be used to make sure that doesn't happen. But congestive heart failure, I think, leads people to believe that the heart has actually stopped, like it's cardiac arrest, but it's not. It's just an inefficiency of the heart to move that blood around. And so gravity takes the fluid, watery portion, and it will just settle wherever it is.
A lot of times we throw around the words like inflammation and fluid retention. What are the similarities and is there any differences between using those two terms?
Fluid retention, that can come from a number of things, whether it be this congestive heart failure. When we anyway talk about inflammation, it's more about looking at inflammatory markers like homocysteine and C-reactive proteins and specific things that are going to be drawn on your blood work. It could be inflammation in your gut. The lining in your gut, the barrier there is deteriorated. Inflammation, there's actually a lot of science being done on it right now. It's one of those kind of catch-all terms that people don't know exactly what to call it in all instances because they can't put their finger precisely on what inflammation means. But you can find inflammation basically in any organ system. But we do have some markers that we can draw on your blood work to look at it too.
Excellent. Thank you, Erica. We have a couple more questions that are a little more personal in nature. I'm going to stop the recording.
Okay.